In the middle of a long hospital stay, sometimes healing comes from something as simple as going outside. One pediatric patient's journey shows us how compassion can make a huge difference. 10-year-old Grayson arrived at Community Regional Medical Center by helicopter. He was critically injured and rushed into the hospital with multiple fractures. His care team worked to not only save his life, but to make his stay as comfortable as possible.
I think of my kids or my grandkids, and you just try to make things better for them. And I think that, being in healthcare, you try to connect with your patients, their family, and you try to make it better for them.
The road to recovery would take weeks, multiple surgeries, setbacks, and long days and nights inside a hospital room.
He would seem to get better, and just when you thought he was feeling better, they'd take him back to surgery and you'd start all over again.
For respiratory therapist Gospodnetich and registered nurse Riva, this patient quickly became personal.
We ended up forming a really strong bond with him and his family, and I had him for a few days. So on one of the days I had him, we noticed that he was sad and depressed and more in pain from all the fractures he got from the trauma.
One day, Monica and Scott looked for a way to change that, to get him out of the room and into a bit of excitement and fresh air.
So then I was just like, oh, hey, let's try going up to the helipad, which I've done before with some pediatric patients.
They only stayed up there for a few minutes, but it still made all the difference.
Get him back downstairs, and then he slept the rest of the day. And the next day he was more active and interactive and smiling, and so it made a big deal. Mom broke down in tears and said that was a big deal for him, that made a big difference.
For Monica, moments like that are why she goes above and beyond for her patients.
I don't really describe it above and beyond. It's something like when you have this connection and feeling of caring for, I wouldn't even call him a patient, you care for them and you almost see him as your loved one. How would you treat a family member? And I loved taking care of him, honestly.
And that bond was mutual between the three of them. Weeks later, the boy was being discharged but didn't want to leave the hospital without saying goodbye.
So when I got to the room, Dad's there, they're calling me by name, and then, they're joking around with me, and it just felt like for him he was worried about leaving and not saying goodbye to me. So it kind of touches you right here,